Hi, welcome to Pathology Riddles. Today, we are going to deal with the differences between dystrophic and metastatic calcification. So, the first difference is in dystrophic calcification, the calcium salt deposits occur in dead and degenerated tissues. It could be parasites, it could be necrotic tissue. While in metastatic calcification, the deposits of calcium salts occur in normal tissues. Another important difference to know is in dystrophic calcification, the calcium metabolism is normal, while in metastatic calcification, the calcium metabolism is deranged. In dystrophic calcification, the serum calcium is normal, while in metastatic calcification, the serum calcium will be increased. So, what are the examples of dystrophic calcification? It could be necrotic tissue. It could be infarcts. Infarcts are nothing but localized areas of necrosis. It can happen in the heart, it can happen in the lung, it can happen in intestines, it can happen in spleen, or old scars or dead parasites. These are the causes of dystrophic calcification. While the causes of metastatic calcification are hyperparathyroidism. It could be due to adenoma or hyperplasia of the parathyroid. It could be because of chronic renal failure. It could be because of bony destructive lesions like multiple myeloma or metastatic carcinoma. Or finally, it could be vitamin D related disorders. Basically, the problems are in all those organs which control the calcium metabolism. So the next difference is about the mechanism of dystrophic calcification. So after cell injury, the phosphatases are released from the cell membrane. So they act on the phospholipids of the cell membrane and generate phosphates. Along with this, the calcium in the mitochondria of injured cells binds and then they form the calcium phosphate. I'm sure you all know that dead and degenerated cells have got a lot of calcium deposits in the mitochondria. Next is metastatic calcification. In this, the mechanism is there is increased calcium phosphate precipitates because of deranged metabolism. So, due to increased serum calcium levels binding with inorganic phosphate ions. This happens mostly in acidic environment. So, dystrophic calcification can occur in any site of cell injury or damaged tissues. While metastatic calcification occurs in certain sites like lungs, stomach, blood vessels, mostly those areas which secrete acid. So these are the 6 differences between dystrophic calcification and metastatic calcification. If you have any doubts, please write in the comments below and we'll try to answer them. This is Dr. Susan signing out until we meet in the next video.